Hello, everybody, and welcome to this short video podcast about Know Your Numbers Week. So an important week in the Healthy Hearts calendar. This is a podcast for people living and working in Nottingham City. And today we're joined by Emma Sawyer and Layo. I'll let you just briefly introduce yourselves. Hello.
Hi.
Emma first.
Hi, I'm Emma Sawyer. I'm a City GP and CVD lead for our PCN.
Great. And Layo?
Hi, everybody. My name is Layo Ogunremi, and I'm an independent pharmacist prescriber. My specialty area is cardiovascular disease prevention.
That's great. And I'm Dr. Andy Foster. I'm a GP and I'm Deputy Place-Based Partnership Clinical Lead. So today we're going to have a really quick conversation around Emma's work in Healthy Hearts clinics, which are being pioneered in Emma's primary care network. Layo's been doing some interesting work with majority Black-led churches around promoting awareness and engagement in cardiovascular disease identification and prevention with relevant populations. And also at the end, we'll be talking about the Know Your Numbers awareness campaign and just highlighting some of the resources that are available. Know Your Numbers Week, I believe, is the 8th to the 14th of September. So I think that's actually next week from when we're recording this. And hopefully adjacent to this video, you'll have some links to some of the resources that we are talking about. Might be nice to start with Emma. Do you want to tell us a little bit about the work that you've been doing in your primary care network around cardiovascular disease?
Yeah, so I work for Bestwood and Sherwood PCN, which covers Sherwood, a little bit of Bull or Hang On Bulwell, and kind of towards Tudor, towards City Hospital. For the last year or so, we've been running community healthy heart clinics. I've been working with the PCN pharmacist, and it's just a different approach really to bring people away from the general practice setting, as an MDT approach in the community. So we have a bit more time for patients, lots of really good conversations, and hopefully providing lots of education. So we've identified patients who may be at increased risk of heart disease by looking at their Q risk and whether they've had a high blood pressure reading in the last 2 years, but no hypertension diagnosis, to try and really look at anything we can do to prevent heart disease, thinking about weight loss, diet, looking at an AF screen, looking at blood pressure monitoring, and then a discussion around lipid lowering management as well. So it's been a really lovely way just to, as I engage patients in a different forum. And we're providing group education, so that's a way for patients just to bounce ideas off each other. And I think that's been so interesting to almost hear patients' own views and own health beliefs and almost challenge it together. So it's been well received. So we're going to keep that ticking over. Had good uptake so far. So just a different way, Andy.
I was going to ask, so for a patient, what would their experience of being involved in this project be? How would they know about it? Where would they go to have these interventions, and what would happen afterwards for them?
Yeah, so I would have identified them through eHealthScope. Then our care coordinator will ring with the information about the clinic. We have an information sheet and a video that we send to the patients just to let them know what to expect. We run our sessions at the Indian Community Centre on Hucknall Road, so fairly central for our PCN. And patients will arrive, they'll have a group education session first of all, where I talk about hypertension, atrial fibrillation, cholesterol management and the Q risk. Then patients move around the room to have their check of their blood pressure, AF, and talk to health and wellbeing coach or Thriving Nottingham. And then we do another session of group education about diet and exercise, focusing on CVD prevention. And then after the clinic, we will then follow up with a GP if, say, there was a high blood pressure reading that needs to be followed up, or an AF screen that was abnormal. And then we send a text post-clinic for any statin follow-up as well. So I then look at data at the end of that just to make sure patients have had the appropriate follow-up.
That's great. And final question, has anything kind of unexpected come up through the work, either things that people say or how they react to the kind of group approach to this, or anything else?
Most people are quite unsure when they first walk into the room, because it is so different. And we all know that people are not always very comfortable talking in a group, but people warm up very, very quickly. I think it's been a real learning curve for me, overseeing the group, trying to manage that very, very talkative patient, for example, or the more confrontational patients. But we managed to challenge some house beliefs about diet, for instance, or about statins and how bad they are for you. So we've been really able to challenge those kind of fears.
You have lots of conversations in my clinic about that as well. So thanks very much, Emma. We might come back to you at the end as we move to talk to Layo. I guess the very last question before we move forwards is this might be something that other people want to do in their areas of Nottingham or even further afield. How might people learn more about your work and how might they get started on this?
So we've created a blueprint document, so everything in there about SOPs, patient information sheet, presentations, that everything is set up and ready to go. Happy that people contact me via email or through the surgery, and happy to speak to anybody about that, any if they want any more information.
Fantastic. I'm going to move on to Layo now. Layo, are you able to introduce yourself and introduce us to the work that you've been doing with the Black majority-led churches?
Yeah, thank you very much, Andy. So I'm a pharmacist. So I came to be involved with this when I went to represent my church called RCCCG CRA in Nottingham, where Michelle organized an event to talk about hypertension awareness in the community. So as part of this, I organized an interactive session in church, up to about 300 people in total, where we talked about hypertension, how to measure your blood pressure. And in addition to that, they had an opportunity to ask loads of questions about, the trust especially about going to healthcare centers or visiting their GP to get their assessment, to get their risk checked. And so we looked at all the modifiable risk factors and the non-modifiable risk factors. And it was just a very interactive session. I shared in the first service. So at church, we have two services. So the first service, I shared a presentation, and at the second service, I shared as well. So, there was a lot of engagement, people asking questions about blood pressure, people asking the concerns, people asking about blood pressure in pregnancy, talking about stroke, talking about heart attacks. And we also looked into how to do your blood pressure as well. So there was a lot of questions about, what kind of device should I use? What is gold standard in measuring blood pressure? And I was able to share like the 24-hour monitoring is the gold standard, but you can still measure at home. And we also talked about how, doing your blood pressure at home, it gives a better picture of what your blood pressure is because you are relaxed at home as opposed to you going into practice. We also looked at into white coat hypertension, that people, when people see the traditional white coats being worn by nurses or pharmacists or doctors, it kind of triggers like anxiety in their mind. And this can also cause like an increase in their blood pressure, and why it's also important for them to do that home blood pressure monitoring. I mean, I didn't want them to feel, too anxious or agitated, going crazy about measuring their blood pressure all the time. Yeah, you wanted to say something?
Oh, Layo, well, I was just going to ask, one thing you said interested me, and you talked about that there might be some issues around trust between that group of patients and the healthcare professional, the NHS. And I was just wanting to ask what sort of themes came up with that?
Yeah, so yet again, it's like, there was a particular question around also talking about the kind of work they would do and the fact that one, they can't get access to the GP, number one. And even when they get access to the GP, they just don't feel like they see somebody who looks like them sometimes. And, they start to wonder that is this place safe or can I just, talk to another church member about my blood pressure instead of going to see the GP? So it's just encouraging them that it is important to be having those kind of conversations with your GP. It's important to, especially if you fall into that risk category where you know that there's a family member who died before the age of 40. So having that kind of conversations about those who are at risk and those who should be going to see their GP to have the CVD risk assessment. Yeah.
And Layo, just running with that, if we are, as a health service, we're looking obviously to get everybody interested in knowing their numbers. That's part of the purpose of this podcast, and taking an interest in their cardiovascular health, their blood pressure, their blood fats and lipids, and all of these factors. Do you have any tips for people trying to get traction with a BAME community in terms of how to engage them better in that activity?
Yeah, absolutely. Because another thing we are planning to do as a follow-up from that presentation I did is to now have workshops. Okay, so we're planning to have a workshop. We're hoping that Thriving will be part of it, and hopefully the ICB will be part of this as well. We're hoping to have a workshop where people can have their blood pressure checked, and so those kind of things, like having activities, looking at the community, like the churches, the religious organizations, approaching the leads, and just reassuring them, like, it's all about raising awareness in the community. It's all about, your health. It's all about you ensuring that you have a good quality of life and, reducing that risk for you.
So I think I'm hearing it's a good idea to engage with community groups in your target population, and to kind of move into their space and have the conversations in that space, and perhaps away from traditional healthcare settings if you want to attract people that don't traditionally engage with healthcare and healthcare settings. Is that the sort of thing that you're saying, Layo?
Yeah, absolutely. Yeah, absolutely. That is exactly away from, the anxiety, the panic, the agitation of going into the clinic setting. Yet again, talking about white coat. For some people, I know we talk about the traditional white coat, but for some people, the moment they enter the GP practice, they're already anxious and nervous.
So that's that white coat hypertension, is that you see a doctor or a nurse traditionally would wear a white coat, and the blood pressure automatically goes up and you don't get a true reading. So we'll talk a little bit about the Know Your Numbers resources in a second, but I just thought I'd just pass the ball to Emma just to highlight, why are we actually bothered about things like blood pressure or cardiovascular risk? Why is this relevant to all of our populations?
I mean, there's a few reasons. I think we know that deaths and events from CVD are still way too high within Nottingham City. And we know there's so much we can do to prevent those events and death. Millions of adults have high blood pressure, often with no symptoms, and we know it can increase risk of conditions like heart attack, stroke, and kidney disease. So, think about the burden on health. It's huge. So it's so important we do identify patients at risk and just do what we can to minimize risk.
Yeah, absolutely. So let's look at some of those resources. Oh, one last thing. In nearly all of the primary care networks in all the neighbourhoods in the city, cardiovascular disease is still the highest cause of avoidable death and unplanned hospital admissions. Just sort of throwing that in as well from a stats point of view for those who are interested in that. So there's still a lot of work to do on cardiovascular disease and its risk factors. So let's pop up on the screen some of those resources. Links to these should be adjacent to where you're watching this video for Know Your Numbers Week, which is the 8th to 14th of September. So here's just an example of some of the stuff. So this is just two of the flyers, but there are posters, flyers that can be downloaded, printed. I think that you can order them for your environment. So that might be your church, that might be your GP surgery, it might be another environment, but you can order these resources. They have a QR code that allow patients to engage with all the other information that backs this up about understanding the importance of blood pressure and other cardiovascular disease risk factors. There's you can have access to trolley coin rings, pens, QR stickers. This is really, really great. Lots of resources that you can have to share with your populations. Have you used these, Layo?
Yeah, actually, yeah. So Michelle gave us like 2 boxes, which we were able to share with members. So that was quite good. And the leaflet as well, we gave to every member of the church. Yeah.
Great. And so use the QR code to access these. And I gather there's also some locally filmed videos. So I can see Clive from the majority Black-led churches here in this picture being involved in a video, and then another lady here. So there's sort of videos made with local people to try and engage local populations. So lots of really great resources. And just popping on screen, people may need to click the file link to really have a look at this. I'll try and make it a little bit bigger, but there is a calendar of events that are happening sort of in and around Nottingham and our local area to support Know Your Numbers Week. Look, there's something happening every day, so have a look at those resources. So let's just take those off the screen so that we can thank both of you very much. Emma, Layo, thanks very much for sharing your experiences supporting people with cardiovascular disease, and hopefully people enjoyed listening to or watching this brief video, and will engage with the resources of Know Your Numbers Week. I think you can use those after Know Your Numbers Week. You know, cardiovascular disease isn't just relevant for 1 week of the year, so so please everybody engage with that. So thank you, Emma. Thank you, Layo. Any last words?
Okay.
Know your numbers.
Know your numbers. Protect your future health.
That's right.
Oh wow, that's a great tagline. I can't beat that. Thanks everyone. Bye bye.
Bye.
Bye.